Hello and welcome to another episode of the Your AKT Podcast. Thank you so much for being a valued listener of this podcast, and please do share this podcast with your peers preparing to take the AKT. So in this podcast episode, we're going to continue with the theme of the NG12 NICE Cancer Guidance. So for this episode, we have a scenario. You are reviewing a 65-year-old patient with weight loss. He has no change in bowel habit. You undertake some initial blood tests which show that the patient has a new diagnosis of type 2 diabetes. His bloods are otherwise unremarkable. Which or what additional tests would you consider for this patient? Now have a think, pause the podcast, and just think about what type of test you may consider in this patient. Now, this is quite an interesting question. In the sense that this scenario is based on a very specific piece of guidance which can often create quite a stir within the question banks. And the answer itself comes directly from NICE NG12 Cancer Guidance. So the answer to this question is that the patient should have an urgent CT scan or an urgent ultrasound scan if a CT scan is not available, and that would be within 2 weeks' time. Now, the reason why we're considering this is the diagnosis that we want to exclude is pancreatic cancer. So the guidance of pancreatic cancer would advise that an urgent direct access CT scan to be performed within 2 weeks or an urgent ultrasound scan if CT is not available should be used to assess for pancreatic cancer in people aged 60 and over with weight loss and any of the following features. So the following features that they have to have in addition to the weight loss would be diarrhea, back pain, abdominal pain, nausea, vomiting, constipation, or new onset diabetes. Now, the argument within the question banks is often whether or not the patient would be more in keeping with a 2-week wait referral, which I can understand. However, this question isn't asking necessarily about referral pathways, it's asking about which additional testing may take place. So it is an important question because it's really important when you're preparing for the exam, not just to think about what referral may need to take place, but also what investigations may take place once the patient has had a referral done. Now, this is where there is a slight kind of blurring of different elements of the NG12 guidance. For example, we know in patients who have abdominal pain with weight loss, then they can have a 2-week wait referral on the lower GI tract pathway. Whereas similarly, let's say you had a 65-year-old patient who had abdominal pain and weight loss, then there's an argument that you could invest for pancreatic cancer. So yes, it can vary upon situations, but generally speaking, for this diagnosis with the new onset diabetes, the question is leading you towards pancreatic cancer rather than a lower GI cancer. I hope you found this helpful. This is as I mentioned, a question that can often cause a stir within the question banks, but I hope I've explained it so that you understand why the answer was indeed a CT scan or an urgent ultrasound scan. Thank you so much for listening, and do share these podcast episodes with your peers. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.